This week's Ask Dr. Durie is about fish testing. Fish testing is something that we've talked about a number of times. Fish is fluorescent in situ hybridization. Basically, it's a fluorescent test that lights up the chromosomes in the bone marrow plasma cells. It requires a bone marrow sample to be tested and examined for the pattern of chromosomes. This week, what I want to talk about is what are the practical details of testing. So one question is, when should the testing be done? Well, obviously, if possible, every patient at the time of diagnosis should have the bone marrow processed for the FISH testing, so we can see if any abnormal chromosome changes are present. These are things like the translocation of the 4 and the 14, or the loss of part of chromosome 17, what we call 17p minus, or problems with chromosome number 1. Those are what we call the bad risk chromosomes, and we're looking for those at baseline. And follow-up testing at the point of relapse is also important. So this is not something that we want to be doing all the time, but if a patient is having relapse disease and there is a critical decision about new therapy, which treatment to use, then follow-up testing can be helpful to see if the pattern is the same or maybe has changed slightly. Another type of question is, why is FISH testing not done as part of all clinical trials? And part of that answer is that obviously this is expensive, and also it does require a bone marrow, and so patients are obviously not keen to have that done all the time. And this is particularly important in what are called phase 3 trials, large studies in which one treatment is being compared against another, where oftentimes it's hard to get accrual of a large number of patients rapidly into the trial to complete the study and get the results. And the investigators are often not keen to have any delays or hesitation on the part of the patients. And so if there would be a hesitation among patients who maybe did not want to have repeated bone marrows done, then the investigator might choose to avoid that delay. Also, the expense can be a challenge. And so many times the FISH testing is not a routine part of a trial, but may be optional. Another key part about FISH testing is, can it be the final answer for what we need to know about the prognostic factors? So that does FISH testing give us all the information that we need to classify a patient as having good risk or poor risk, or as a category of patient for one treatment versus another? And the simple answer to that is that FISH testing is not the final answer. And in part because it's a bone marrow test, and in part because we need additional information, we need to keep looking for better tests. And my own personal view is that we should be looking for a good blood test that would identify patients who need a particular treatment versus another type of treatment. And so FISH testing is something that we're doing right now. It is important. But moving forward, a year from now, or certainly 3 to 5 years from now, I expect that we'll be looking at other kinds of tests that will guide the choice of therapy.